Intellectual disability is a disorder of the brain. The main issue there is the difficulty learning new skills. And this is often seen in the child's academic life. So it starts in early childhood as well, and it's also lifelong. It's a lifelong condition. So the main thing is that the child is not able to learn new skills and often in academic skills. So very early in childhood, the first things that a parent may notice is that the child is not developing like other children their age. So in every aspect of their lives, whether in their motor skills, that is their ability to move and walk and point, they are not developing like children their age. And then they may also not be able to develop social skills like children their age. As they grow older and they start school and interacting with peers, you also notice that skills that children their age are able to do with ease, they are not able to do. They may not be able to pick up academic skills very easily like children their age. And as they grow older, the challenges are more apparent. It also shows up in everyday activities at home. So it's not only about academic skills, but even things like ability to understand money, ability to read the time, to understand the emotions of other people. All of those things are affected in the condition. Intellectual disability has a multiplicity of risk factors. So we don't have one particular thing that we can point to that causes intellectual disability. There, there are things that can be pre-conception. So even before the pregnancy, delivery, such as genetic risk factors. So if somebody in the family was not very good academically, it's likely that the child or a parent was not very good academically, the child may also have the same issues. Then surrounding pregnancy and delivery as well. So very difficult pregnancies. Somebody who was sick throughout the pregnancy, the child is born, they may be predisposed to intellectual disability. During delivery as well, when the labor is prolonged and then there is bleeding as well during the labor, the child comes out and the child is not crying immediately. They have to um, do things to make sure that the child takes their first breath and cries. All of these can be risk factors. Also, having severe infections in early infancy, having jaundice or yellowing of the eyes, having seizures that are not treated. So if a child starts having seizures, it's important that they are treated immediately. And then having severe accidents such as head trauma, a fall from a height, all of these can affect the brain of the child and lead to intellectual disability. Intellectual disability has a wide impact on the child's life. The main thing is that they are not able to fit in the academic world. So it makes it very difficult for them to learn and progress in their schooling, and they may have difficulties, especially with the very technical subjects like maths and science. So those are the main things. And it's also a spectrum. So depending on the severity, it shows up in different ways. So some of them may be good readers, but when it comes to maths, they are not able to function at all. So often we see them repeating classes over and over again. Some of them are not able to go to school at all because of the severity of the condition, and it makes them not progress academically. Intellectual disability doesn't mean a child is hopeless. Once it is recognized and interventions are put in place, a child can live a full life. They may not be able to attain academic heights, but there are a lot of skills that they can learn and they can become self-sufficient depending on the severity. For the very severe forms, they may need lifelong support, but even then, it doesn't mean that they are totally hopeless. Intellectual disability often comes with other mental health issues. Commonest are seizures, and then they may also have depression. Also, because they go through a lot of frustration as they are going through school, they are not doing well, they are prone to being beaten a lot in school because people misunderstand that it's not that they are not working hard, but they are just not able to learn. And they also tend to have psychosis, what we call psychosis. So, abnormal behavior, hearing of voices that do not exist. All of these are because there's something going on in the brain that predispose them to the other conditions as well. So, some of the risk factors in intellectual disability can be prevented. The common ones are the ones associated with pregnancy and delivery. So it's very, very important to seek full medical care during pregnancy. Take the prenatal and during pregnancy vitamins that are given. Have skilled delivery at birth. So it's important to deliver babies in a hospital where if things are going wrong, there will be somebody to intervene. And also, when there is yellowing of the eyes, immediately seek medical attention. When a child has an infection, promptly treat it. And then also, when a child has seizures, immediately get the child to a hospital to be treated so that the brain is not put under stress from all of these. So, if a parent suspects that their child has intellectual disability, the first step is to have the child fully assessed in a hospital. Once the child is assessed and we know the challenges that the child has, we'll be able to recommend the things that will work best for the child. For most of the children who have intellectual disability, they are able to do well with minimal support. So just knowing which kind of school system works best for them will make them do well and they are able to live a normal life. That is for majority of the cases. For a few of them, they may need more sophisticated and more detailed support because they are not able to live self-sufficient. Those supports are also available. So once the assessment is done, we are able to guide the parent to the right resources available for them. Okay, so in Ghana, we have some schools that are integrated. So what that means is that they are regular schools that provide services for children who do not have any challenges at all. And in addition to that, they have support services for children with intellectual disability. Majority of these children can survive in these kind of schools. These are available. Then we also have special schools that are mainly for those with moderate to severe forms of the intellectual disability. These are also available. Then we have some support services such as occupational therapy, behavior therapy, and speech therapy. So depending on the specific needs of the child, we are able to give these all supports as well for the child. So in summary, intellectual disability is a disorder of the brain, is lifelong, but there are several support systems available for the child and the families when they are assessed. So it's important for the assessment to be done in a timely manner as soon as you suspect that there are signs of intellectual disability so that we can guide you to the right resources. Thank you.